So the truth is that having an MVP isn't the end of the journey, but rather that new beginning in which you get to validate and iterate, but most importantly, get your first customers. So, do you have any advice for healthcare entrepreneurs that maybe have not gotten to the MVP phase yet on how to think about going to 0 to 1, not just in terms of design and MVP, but in terms of zero customers to even one or multiple customers?
Yeah. This may be a little untraditional, but one thing I can
Okay.
share about healthcare for sure is that it's very relationship driven still, and
Okay.
I don't see that changing in the short term. So I have many amazing uncles.
Okay.
One of which though it tends to drop some nuggets. We all have a couple of uncles that give you or aunts and uncles that give you that good advice that somehow your parents
Right.
can't
The
teach you
straight
stuff.
shooter.
Yeah,
Yep.
right. So he taught me when I was young, like, hey, listen, warm intros make the world go round, right? And I think that applies more so in healthcare than anywhere else. And so I think when you're early on, focusing on the relationships and getting warm introductions to possible customers is the best through your network or one way or the other, building the relationships. And I think that's critical because that's a skill set you need to develop to have to grow your company anyways. You're not going to, most healthcare software companies aren't going to just like build something and people like, that's so cool. And just put up a website and do some SEO, mark Google AdWords, and like everyone starts buying it. That hasn't really been a successful path for most healthcare startups. So if you're
Right.
doing something, if it's relationships, you got to build that skill set. You got to build that network up a little bit anyways. You might as well start early. And when you get a warm handoff to a customer, whether it's a health system with more red tape or it's a solo practitioner or small billing company or whatever it might be, that warm introduction where it's relationship based, they're going to give you more of their time and they're going to give you more genuine feedback, which is what you really need early. Yeah, and then once you've done one or two, you've made enough of those, then you'll also probably know an efficient pathway to get, I don't want to call it more cold intros, but a pathway to get to, once you've met one orthopedic group, now you have a little network, maybe you understand them better, you can figure out how to walk into the next one and say, hey, I'm working with so-and-so, I understand that this is your
Right.
spirit, you can empathize with them more, and then you can do it, customers 3 through 5 become a little bit easier to get.